So I want to talk about non-traumatic pain in your like low back or your neck or one of your joint areas. One of the things that's really common and never talked about is how you have hormone receptors on those ligaments, okay? And also where they insert into the bone and called the endosteum. And those areas, if you have hormone imbalances because you're perimenopausal, menopausal, or if you have period symptoms, PMS symptoms, or difficult periods, or fibroids, or cystic ovaries, those are all hormone imbalances with or without some blood sugar issues, and all have an inflammatory component. Those are never normal, none of those things. But ligaments actually become very damaged if you don't have enough sex hormones as a woman. Men have less issues because their testosterone is very consistent and they don't have as much fluctuations, where we ebb in the, or we cycle, we grow flowers and then we drop seeds every month. So we have this flow of hormones that is actually very easy to disrupt, and which is why we see so many issues with women and their cycles. But remember, those are your body trying to tell you, pay attention, right? Something's going on. And so when we look at women as we go through perimenopause and into menopause, you can start having more pain issues. You can start having loose teeth, never talked about really at all. And of course, all the other symptoms. But if you're all of a sudden like, man, my low back starts to hurt, and remember that it's going to be worse from sitting, which increases the load on your low back by about 150%. But if all of a sudden you're not really changing any big routine, you could be to a threshold point. And you also could be then compounding that with having hormone imbalances. So it's really important to get your hormones checked. And so when we check hormones, we use a urine test, which is a hormone metabolite test, and a salivary adrenal panel. This lets us, those are the most correlative to tissue concentration. A plasma test or blood test, that is what's in the bloodstream, not necessarily correlative to what's in the tissues. And this matters because you need to know what's in your tissues, right? And you never, ever, ever, if you have a doctor treating a number on a lab test instead of your symptoms, they're not doing a good job, and you need to find yourself a new doctor, because that's not how it works. You got to treat you as a whole person. And I hope that's helpful. So if you're having any of those things, remember, it's not normal and you don't have to suffer.